Greetings, everyone, and thank you all for joining. My name is Purrier, and I'm the project director of the Implementation Science Coordination Initiative, or ISCI, which is a federally funded supplement supported by the National Institutes of Health's Ending the HIV Epidemic initiative. As part of our mission to create opportunities for generalizable knowledge to help end the HIV epidemic, we are proud to present our inaugural EHE project webinar presentation. These webinars are held quarterly and bring together principal investigators of EHE-supported supplements to share strategies, outcomes, and discuss actionable strategies for both scholars and practitioners. Today, I am proud to present our theme of PrEP interventions with Black communities and introduce our 3 scholars for their presentations today. For our presenters today, we will start off with a presentation from Dr. Amy Corneli, an associate professor in population health sciences and medicine at Duke University, who will be presenting on PrEP-MECK, increasing PrEP uptake among Black same-gender loving men in Mecklenburg County, North Carolina. Then we'll move on to Dr. Sannisha Dale, an associate professor of psychology at the University of Miami, who will present on the 5-point initiative, advancing HIV prevention in Black communities. And then finally, we'll have Dr. Jessica Corcoran, an assistant professor of nursing, community health systems at the School of Nursing at the University of Alabama at Birmingham, presenting the implementation of HIV testing and linkage to PrEP at an HBCU in Alabama. Each of these presentations will be roughly 10 minutes, with the presenters sharing their respective slide decks. At the culmination of all 3 presentations, we will open up the discussion to kind of a far more interactive discussion among our presenters and, of course, among our audience members as well. Although we are coming in with many kind of prepared and moderated questions, please feel free throughout all of the presentations to utilize the Zoom chat feature. And I have multiple members of my fantastic team who will be actively monitoring that chat, and then we'll be able to introduce those questions into our larger discussion after the presentations are completed. With that, I am very happy to now pass it on over to Amy.
I will share my screen. Terrific. All right, so I'm going to move the camera so I can see my slides. Terrific. So thank you for inviting me today to speak with the group. And my name is Amy Corneli. I'm with Duke University. My pronouns are she, her, hers. And I will be talking about PrEP-MECK. And it's an ongoing project to increase PrEP uptake among Black same-gender loving men in Mecklenburg County, North Carolina. So the overall goals of this webinar are to provide strategies, ideas, processes, things that we have done along the way that we could inform other people's work around PrEP interventions for Black communities. So what I will focus on is to describing what I think have been successful strategies that we have used along the way to develop the PrEP-MECK program, as well as to plan for future implementation of what we've developed. So I'd like to start with just a quick snapshot of what PrEP-MECK is. So we received 2019 and 2020 EHR, the CFAR administrative supplements for the EHE program. And it's focusing on increasing PrEP uptake among Black same-gender loving men. And so Mecklenburg County is Charlotte, North Carolina. And the overall goals, I mean, we had specific aims, of course, for each one of these supplements, but the overall goal is to identify determinants of PrEP use among Black same-gender loving men, and then implementation strategies to address them, and then to plan for implementation research for the future. And just to give you a hint of where we landed and what we were going for is to enhance a local CBO's existing PrEP promotion efforts, and then to extend PrEP delivery by local PrEP providers, And then all the work that I'll describe today is in this manuscript that is at the bottom of the screen, the EHE supplement in JADES in 2022. There's three such successful strategies, or strategies I think we all think that we're successful in what we did with PrEP-MECK. The first one is to identify and engage community partners from the start, and then throughout the whole planning process, and now it'll be throughout the whole implementation process if we're so lucky to keep getting funded. Follow the data, and then again, establish more partnerships to address the data that was identified. For us, it was identified to address some barriers that were identified in the data. And then really focus on that co-learning aspect and incorporating team members' expertise into all the decisions that we make along the way. Okay, to start with identifying and engaging community partners from the start. So with our 2019 supplement, this was a new group. The purpose of it was to build this new community academic partnership, and it was with Chelsea Golan, which is from RAIN. So RAIN is a community-based organization that has been serving the Charlotte community for 30 years, focusing on providing services with people with HIV and also for HIV prevention. We partnered with Wesley Thompson, who is a PrEP provider serving the LGBT community for a very long time in Charlotte. And then Susan Reith and myself then were the academics from Duke University. And one thing we knew really early on is, even though we had this nice group of different players, you know, we had a CBO and then a PrEP provider and then researchers, we knew we needed to have more community influence and telling us, you know, giving us that direction on what we needed to do from that lived experience, either as being a client, provider, or a program implementer. And we wanted that experiences, we wanted the recommendations to guide us. And so we established the PrEP-MECK Coalition. And that included other local NGOs or CBOs, community representatives from the public health department, other PrEP clinics, and then Black same gender loving men who were not affiliated with any organization. And this is just a timeline and some activities that we did as part of this original supplement. So the PrEP-MECK Coalition, fortunately, we were able to meet in person twice before everything shut down for the pandemic. So this has been going on for a while, but we were able to have that face-to-face time, which was quite lovely, and really have these conversations about what's going on in Charlotte with HIV prevention among Black same gender loving men. What do you want done? Where should we focus? Who should we talk to? How should we conduct research? Because we knew we were going to do some formative research. So we had 2 meetings to talk specifically about that. We then conducted formative research. We did focus group discussions, in-depth interviews. We did community-based assessments. And then took all those data and had all these meetings with the coalition, with all these partners, and talked about what those findings meant. We brainstormed what implementation strategies might be good to address those, but we did identify a need for new partners based on what we were learning. And the formative data in that, men told us that men in the community were concerned about PrEP costs, that it did get perceived to be too much. And then that just limited all interest in learning more about PrEP. There was limited awareness of just local clinics around town that provide PrEP. Men spoke about limited Black representation. They didn't see other Black men in clinic waiting rooms. They said it would be difficult to talk to providers who are not Black or same gender loving. And they said, ultimately, it's really hard to schedule clinic appointments, given their time, the clinic hours and such. And so what we did is there's a wonderful initiative that's in Charlotte that's part of the Mecklenburg County Public Health Department. It's part of the Mecklenburg County Getting to Zero Committee. And they have funds to provide to clinics who they're partnering with. So the clinics can provide PrEP services for free to residents who have no insurance or are underinsured. And so we reached out to all 7 of those clinics at the time. There's more now, and 4 wanted to partner with us. And the 4 are listed at the bottom, and they have Black providers and some Black and gay providers. And together, then we submitted another supplement. Both of these were 1-year supplements, and then we were funded in 2020 to continue planning for what we want to do in terms of implementation strategies in Charlotte. And this shows you what we do. So we had this, this all new group, and we had a series of clinic working group meetings and partner clinic working group meetings where So focusing on the clinic aspect, so those clinic providers I mentioned, and then the Duke folks, we met 6 times over that year and really spent time getting to know more about the clinic population, what the clinics have done in the past to try to increase PrEP uptake among Black gay men, what were things they wanted to try, and just think through the data that we had as well. And then we did identify clinic level strategies that they thought, okay, these are going to be acceptable and feasible to me. And then we had a partner working group where we wanted to focus on a client level strategy. And through talking with the partners, social media came up a lot in our data. The partners decided, social media would be a great thing to focus on for a client level. So then we had a series of small working group meetings with a multi-diverse group that looked through our formative research, identified what were the really key factors, developed mock social media content, all the things that go with it, hashtags and graphics and such. We did more focus groups to test that out. And then we created yet again another partnership, the Black-owned social media firm, the GSW Media Group, then to take all those data and make that into a social media campaign that looks really good because it was professionally developed. And the last part is really just that focusing on that co-learning and sharing experience. And as I mentioned, those meetings that we had really focused on what do the community partners want to do, interpreting those data, thinking about their experiences, what will they want to do that they think are acceptable and feasible. And so for the clinic level strategy, all the clinic representatives decided they would like to do this change infrastructure strategy where they would initiate, integrate, and promote drop-in appointments at their clinic. And what we talked about then is the partners, each one would choose a different day where they would then offer those drop-in times. And so that just extends the amount of opportunities that are offered to men in the community. And then the other one that was chosen, as I mentioned, was the social media campaign. And then that would be implemented through RAIN, which is the community-based partner in all of this. And so our next steps is to pilot this. We have submitted an R34. We hope it will get funded eventually where we can pilot the implementation of these. Again, we have partnered with, yet again, more people to be able to implement this. We're now working also with the Academy for Population Health Innovation and again with the Mecklenburg County Public Health Department. And here's the community or the clinic partners that we're moving forward with in the R34. And to conclude, just like to say thank you to the large team that we have, members of that PrEP-MECK coalition who have been so helpful along the way, and also the Mecklenburg County Getting to Zero Committee. They're such a committed group to preventing HIV, supporting people with HIV in Mecklenburg County, and they have given us advice along the way. We attend their meetings along the way, and so we're always grateful to them. And as you can tell, we're very much into partnerships. So if anyone's ever interested in being part of PrEP-MECK, please give me a shout. Thanks for your time.
Well, thank
And
you.
I think it's mine. Oh.
Indeed it is, Sannisha. Please.
Okay. All right, I'll jump right in. So hi, everyone. Nice to meet you again. I won't belabor the introductions, but here's some stuff about me. I am Sannisha Dale. I'm at the University of Miami. I do work in Miami around HIV, mental health, and health equity. Pronouns she, hers. Okay, so just some quick disclosures. I do serve as a PI and a co-investigator in a Merck funded study among diverse women who may be placed at risk for HIV. And I've also been a consultant on a work group for Gilead Sciences around engaging people living with HIV. So we know that the work takes a village. So this is a picture of some of my team members here, but we're a pretty solid group who carry out this work in our SHINE research program, which again is focused on the domains that I talked about previously. So the 5-point initiative, to clarify, this was funded as one of the original EHEs, so the 1 year, and then it was funded as a 2-year EHE to continue to expand the work. And essentially, the goal of the 5-point initiative, and the 5 points have to do with actually the category of businesses that we partner with. And so we partner with venues in predominantly Black communities and predominantly Black communities that are also high impact in terms of HIV in Miami. We also collaborate with community health organizations who are already funded by other agencies to provide mobile services in terms of HIV testing, PrEP, et cetera. And we host outreach events in which residents complete an electronic survey in exchange for a cash voucher that's used in the venue. And for the first Plan and Aim, that was just 1 year as we were planning the pieces, they were offered HIV and STI testing and condoms and PrEP information, but it was not a requirement for them to engage in testing. And so the first year we realized that people would be open to it if it was linked to a requirement through doing the work and through asking folks. And so the second year, we then expanded the work actually and went from going into 5 zip codes to then going into 12 high impact zip codes, building the partnerships and relationships with additional community businesses, conducting more of these kind of outreach events. That's what participants see and what community members see. They see that people are coming out to engage with them. It doesn't typically feel like research, but we know that they're research goals and outcomes that we're looking at the back end. But for the second part of this, we actually require the HIV testing to engage with the team. What you saw at the bottom there, again, it requires a lot of partnerships. So those are a good number of the locals of our health partners. So as I said before, it includes coordinating outreach events, community residents engaging in these different pieces. And what you see on the right-hand side, it gives you a sense of what kind of categories of venues and what voices are at the table. So we partner with laundromats, we partner with car service providers, so gas stations, mechanic, et cetera. We also collaborate with health, beauty supply stores and barbershops. And we also collaborate with corner and grocery stores, which actually ends up being the businesses that end up getting the higher reach of participants. So this model has been embraced by community, and there are a couple of reasons that I think has made it something that people gravitate towards and like. One, it's who's at the table. So when we talk about key voices, it's not just the research program and members, it's community consultants. So we hire people from the Miami area with lived expertise, oftentimes have been entrenched in community activism and outreach and health equity work. And they're hired to be consultants of the team to continue to provide insights, to meet with the team, but also to leverage and build those relationships between the work that we're doing and community businesses. They also tend to have really spectacular insights about what businesses to partner with and what days of the week and times have the highest potential reach for the individuals that we're interested in reaching. In addition to that, as we do this work, we're always actively listening to the live feedback we get from community residents when we're out there in terms of ways to continue to improve, things that could be tweaked, et cetera. And of course, again, we partner with the community health partners. Why do people gravitate toward this model? And we've gotten a lot of feedback is, one, the cash vouchers play multiple roles. So the cash vouchers make it so that as we're engaging the residents, they have a direct benefit in terms of engaging, right? However, those vouchers are linked to the businesses. So simultaneously, the businesses are increasing their revenue for the day. So they see it not just as an altruistic behavior, but something that recognizes their model and their needs as a business. So it's also helping the businesses to build. For the community health partners, it's increasing their reach because they're doing this as a part of collective action. They oftentimes don't have these relationships with local businesses. And so for them to be able to be a part of the model and to offer the services that they're otherwise being funded for, but to actually kind of really increase their reach is something that they appreciate. And we heard that a lot qualitatively as we were doing this work in terms of, hey, when are we on the calendar next? And, we even had one partner who said, can we be the sole community health partner that you partner with? And we had to kindly say no, because it's collective action. We need as many of us at the table as possible to continue to do it. The other part is the compensation for lived expertise. So we don't have a standard kind of like CAB. In fact, because of the fact that the community consultants are an active part of it and they're paid. But beyond the consultants, members who are full-time benefited employees and SHINE also represent the community in many ways in terms of lived expertise and proximate distance to the issues and the locations. So over the 3 years, I would say, so the 1 year and then the 2 year, we have partnered with over 80 local businesses in the categories mentioned, 8 community health partners, and have had over 6 community consultants. And I'll talk a second about how that number has kind of blown up as well in the work that we're currently doing. But this occurred within the EHE. And again, in terms of the community engagement strategies, there's a lot of bidirectional communication. We debrief following each event. We have weekly team meetings with all team members and the consultants. We also have resident feedback. So we get feedback on the survey that they do, but we also listen to live feedback and make note of things. And we do exit interviews with the businesses in terms of, again, what could be tweaked, what could we do better? And a lot of bidirectional communication with our health partners. These are images on the right of community consultants and experts over the years. One of them is actually a longstanding full-time benefited team member now, and others have gone on to do many other beautiful things, but are still a part of the 5-Point Initiative and serving more as in a senior advisory capacity now. At the bottom, you see images with our businesses and some of their owners and partners, because even though they get to increase their revenue, it's a partnership nonetheless. So we also give out appreciation certificates and reach out to them and so forth. These are images of to kind of give you a visual of what it looks like. So we go out, it's coordinated. We show up with our community health partners, members of Shine, members of the community, again, and we set up like this. We're there, we wear a common logo so people get to know us, know our image. So they might be like, I saw you guys the other day and I didn't have time to stop, but now I'm stopping. Or we met you before and I'm telling my family to come down the street and do it today because I did it before and it was great. And so we go and we set up, and again, they approach us. We have them complete a survey and then engage in HIV testing. They're screened for PrEP and then linked to PrEP as indicated. So these are some of the outcomes over the EHE. We conducted over 64 events, partnered with over 80 businesses, engaged over 2,500 residents, administered over 1,800 tests. One thing to note is that even though our engagement with the residents was 2,500, this test number doesn't equate with that, because we also, beyond having it be involuntary, so everyone wasn't required to do the test in the 1 year one, we also did something that was driven by ethics and community voice. So this project started in 2019. The onset of the COVID-19 epidemic came. And then when it came to that, we saw an opportunity to offer COVID testing via this model as well. So what we did is that people could choose what health behavior they wanted to do. So we offered them either the HIV testing or the COVID testing. We didn't want to require them to do both. And so some folks would take and do the COVID testing versus the HIV. And the other thing we did is that once vaccine became available, we did the same thing where people could opt in terms of getting a COVID vaccine or a booster versus an HIV test. We know that it impacted our numbers, but again, it's a matter of ethics, because the same zip codes and communities that are being highly impacted by the HIV epidemic are also highly impacted by COVID-19. But we saw a lot of good numbers that we wanted to see in terms of the outcomes, and got a lot of things to kind of inform the work that we're doing now. Generalizable lessons learned. I think I'll jump straight to the bottom one. Purpose, commitment, and adaptability is key. Community residents also become a strong source of support for the work. So we'll often plan to say, we're going to aim for engaging at least 50 community residents at a given event. However, there are times when there's a community resident who's very pumped up about what we're doing. And so they're calling out multiple people to come. And so we've had upwards of 100 participants at times engaging with us. The other part is, again, valuing the key part of equity, making sure that every voice at the table is being valued in ways that is meaningful to them is important. And then also FPI, it's promising for EHE initiatives, but also beyond that, because other health behavior can also be swapped in. And we actually had an instance too of swapping in health behaviors such as cancer screening on 1 or 2 occasions where that was also offered to community members. In terms of next steps and what we're doing, we were funded by NIMH to do an R1, which is a cluster randomized trial of the bundled implementation strategy that FPI is. And so we are starting that work now. We actually started doing our pre-assessment work a couple weeks ago. And essentially what it'll come down to is that we are going to be in 8 high impact zip codes. We're going to be in each zip code for 21 months. And we're capturing a lot of different measures in terms of implementation science. Just some acknowledgements before I wrap up. Again, couldn't do this without the residents and the participants, the SHINE team, community health orgs, community consultants, business partners, our centers here in Miami, and the funding that we received. I'll stop there.
Excellent. And then moving along to our next and final presenter, I will pass the metaphorical mic over to Jess Corcoran.
Awesome, thank you. Let me share my screen. So, all right, sweet. I'm Jessica Corcoran, and I'm a co-I on this project. I'm presenting on behalf of the program or the project directors. Billy Kirkpatrick is our community partner. He is a community PD. He is the CEO of Five Horizons Health Services, our community partner. And then Miriam Kemp was the academic PD for this EHE supplement. This is a 2021 supplement. And she is a professor of nursing and medicine at UAB. So just a little bit of background here. I mentioned Five Horizons Health Services. They are our community partner and a community-based organization. They have been providing HIV care, linkage to care, and PrEP for community members on and around there in this red star here. So about the middle western part of the state. This is the state of Alabama, for those of you if you're not aware. So in about the middle western part of the state here, Five Horizons Health Services provides care to people living with HIV, and also one of their 5 pillars, they have 5 pillars of care. One of them is outreach, prevention, and outreach. And so they are several miles away from Stillman College, which is an HBCU in the state of Alabama. There are 13 HBCUs across the state. They're indicated here with stars, but red is Stillman College. So they recognize an unmet need for HIV testing and PrEP referral on the campus of Stillman College. Stillman College didn't have any healthcare services on campus, and so students were having to travel off campus to receive healthcare. And so they conducted a needs assessment in the end of 2020. And the college students really, their strong desire was for STI testing. But the folks at Five Horizons said what they noticed was that this provision of affordable and free STI testing and treatment could be used as a bridge or a foot in the door to get HIV testing and PrEP to a group that needs it. So we know disproportionately, especially in the South, in Alabama, Alabama is one of 5 states with the greatest unmet need for PrEP, and also the greatest unmet need, the age group with the greatest unmet need, according to AIDS View in 2022, was the adolescent young adult age group. So that's our 15 to 24-year-olds. Really, we're sometimes missing the bar there with PrEP as PrEP is rolled out for a lot of reasons. And so Five Horizons, noticing this in the community, said that they wanted to do something. So what they did was they bought a building across the street from Stillman College, the HBCU in Tuscaloosa County, Alabama, and they basically made it a community hub where they could do free and affordable HIV, STI testing, condom distribution, sexual health education, and linkage to PrEP. And so we partnered with them to that end to really understand and evaluate this program, which they call 5 Spots. So it's Five Horizons at Stillman, and they call it 5 Spots across the street. And so this program provides, the goal of this program is to provide HIV and STI testing to students at Stillman and throughout the community there in the West End community of Tuscaloosa County, Alabama, and also PrEP linkage. And then the goal in the future is to expand to mental health services and other services that are needed in the community. So the goal here was really just to increase testing among adolescent young adult population and prioritizing area with the highest incidence and unmet need for PrEP. In this map here, this is an HIV testing screening map. So this is per 100,000 15 to 19-year-olds in the state. This was, I believe, 2021 data. And you can see the highest prevalence counties here kind of in the middle of this state right here. And several of these have our HBCUs are located within the counties in the state. And so our goal with Five Horizons is actually to continue to partner and move this this project if it was effective and implementable at other HBCUs across the state. And we've already locally partnered with, I believe, 3 or 4 other HBCUs, but currently this work is just the work that we did at Stillman. This is our formative, the first partner and first time we've tried this intervention of integrated HIV STI testing and PrEP for college students. So the way we wanted to evaluate this, we kind of did a mixed methods approach here. So we wanted to evaluate the implementation of this testing and PrEP offered to young women, men and women at Stillman through documenting uptake of services. So what's 5-Spot doing? How many tests are they doing? How many students are they reaching? But also we did surveys, Qualtrics surveys with students, and then we did 30 interviews with a subset of students who had used and not used services to really understand what's the feasibility and acceptability of 5-Spot, the clinic across the street from Stillman, and what is it that the students really wanted from 5-Spot. So from the project period, this was a 1-year EHT supplement 2021-2022. We had a no-cost extension. So this is data from May of 22 to April of 2023. The 5 Horizons Health Services 5-Spot outreach team conducted or was a part of 41 distinct events on and around campus. These are flyers from some of the events and some of the pictures from the different events that were held during that time, and here's a list of them. And then for testing wise, from that same time period, May of 22 to April of 23, at Stillman College, so that's this bar here, they conducted 230 STI tests and 196 HIV tests, and then throughout the community broadly. So they also provide services to the University of Alabama students who are just a few miles away, and then within the community in Weston, Alabama, they conducted in total 350 STI tests and 586 tests for HIV. And then here are the reactive tests here. There were 30 for chlamydia and 10 for gonorrhea, and then several for trich and co-infected. And then there were 2 positive for HIV in this time period who were linked to care at 5 Horizons. So as I mentioned, we collected data on the uptake of 5-Spot from the clinic side, but then we also did surveys, 132 surveys with students at Stillman College. So these could be students who'd used 5-Spot, could be students who have not used 5-Spot. And so the average age of these students was 21, and 90% identified as Black or African American, 63% identified as heterosexual or straight, so 37% identified as a sexual minority. And then about 60% had ever been tested for HIV. This is better than the state averages, about 30% of people in this age group have ever been tested. So more students have been tested that completed this survey. When we asked them if they'd ever heard of PrEP, so these are college students at Stillman, about 60% had ever heard of PrEP. The majority had heard about it. 22 students had heard about it at 5-Spot. So we know that students are learning about PrEP. Had ever taken PrEP, only 3 students said they'd ever taken PrEP. When we asked students if they would be interested in possibly taking PrEP, 50% of students said that they would be interested in it. So the acceptability of 5-Spot, this STI and HIV testing and PrEP referral services. So at the time frame, there were 132 students who did this survey. 5-Spot had only been open for less than a year when this started, and 59 students had access services at 5-Spot, which is about 45% of students who were surveyed. So these surveys were done on campus, so not only just at 5-Spot. So the fact that 45%, you can look at that as a positive or a negative. I think the reach that 45% had used services there when they'd been open less than a year is fairly good. And we're going to continue this work to see, as 5-Spot has been implemented there for a longer, is the reach of 5-Spot within the Stillman College community, grown. But of those students, I think a really great positive here is that 96% of the students reported that they were likely to return for future care at 5-Spot. And the most common services used here were STI testing, which is not surprising given that when they did the needs assessment, students said what they're really interested in is STI testing. We had 52 students who at this time had reported that they'd used STI testing, 40 students did HIV testing, and then 5 are referred for PrEP services. So like I mentioned, we did the surveys. We also did interviews with the students. And so these are kind of the key takeaways that I wanted to share with you all for why did the students say that they used this service? Did they like it? What was positive? And what are they kind of like, what were the ways that we were able to recruit and retain students for this testing and PrEP intervention? And so there really were kind of three main themes that the students addressed here. And the first was robust campus engagement. So students, so the things that students said were multiple contact points with students. So I showed you the 41 engagements that the Five Horizons outreach staff had over the year. This is what one student said. She said, I know 5-Spot is, they're all about sexual reproductive health. A couple of times, 3 times now, I've seen them on campus in the past 2 weeks, giving out condoms, carrying out free tests, just giving out information on how to be healthy sexually. They were actually the ones that organized this sex talk during freshman week. And so that really highlights this campus engagement of multiple engagements and organizing talks for the freshman students when they come onto campus. And so that was something that was viewed really as like, as students saw 5-Spot on the campus more and more, it became more acceptable to them to go and learn about the services provided there. Another really interesting strategy that they use is they actually hire a couple of peer mentors or student ambassadors to work at 5-Spot, but also to go kind of spread the word and get students to know about the services and have them come do the testing. So one student said, I would say that they have student ambassadors who continually reach out to other students because sometimes students are very comfortable interacting with their peers. And then another incentive that we know very well is incentives. So they would provide gift cards. They would also provide food at most of these events to kind of incentivize college students to come and hear about what 5-Spot is doing and then hopefully get tested. The second theme was convenience. And so for them, this was not just convenience that it was walkable to campus, but students said, you know, they're as convenient as they can get. They're right down the street. But also the hours of operation. So one student said, you know, they're right across the street from campus. They're open from 10 a.m. to 9 p.m. So you have multiple times to go get tested. You can walk in. They help you with personal problems. It's always confidential. It's just a safe space that they get to talk about your sexual health, get advice on life in college. I feel like it's all around a great experience for everybody. So that was what does this person like about 5-Spot? And the last theme was once the student got to 5-Spot. So once they had this robust campus engagement where they saw 5-Spot on the campus, they became comfortable with it. Then what retained students to continue to get testing and to tell their friends was a positive presence on campus. And so this included things like having a non-judgmental atmosphere, treating students like adults, and letting the students set the agenda. And so what one student said, he said, they treat you like family. They help you understand the ins and outs about life and sex in different ways that you can catch sexually transmitted diseases. And then another one said, talking about the non-judgmental or removing stigma, the director of 5-Spot talks with the men and women about their sexual health. He lets them know about it. He changes the stigma and the myth. It's a very open and safe place for students. Everyone's engaging and talking about it, and it makes them want to talk about their sexual health and being able to take care of themselves without feeling judged. And then another student, she said that she felt like it was comfortable because they didn't talk to them like they were kids. They talked to them like they knew what they were doing. And so broadly here, just to close, really what we believe so far has made 5-Spot success, and we hope will continue to make 5-Spot a success, the kind of the secret sauce here is starting with that robust campus engagement to really remove the stigma and the barriers to HIV and STI testing and PrEP. And then you have to kind of have that cornerstone or that bedrock of convenience, being close and being open and meeting the students where they are. And then to retain students and keep them coming back and telling their friends, you really have to have this non-judgmental environment where you treat the students like family, as one of the students said. So
excellent. Well, thank you all, Amy, Sannisha, and Jess. These have been phenomenal presentations. And one of the strongest points that I feel like I am now excitedly taking away is very much this strong focus on the kind of co-creation of community partnerships, having it very much be kind of a two-way and much more interactive experience, whether it's campus engagement and peer mentors, whether it's actually going explicitly to the venues, whether it's engaging community partners at every possible stage and bringing them in. It's very nice to see across y'all's work that kind of thread line translated in many different ways. And so now I'm going to quickly peek at our chat, which is already starting to get a lot of questions and engagement. So of course, a reminder to everyone, please feel free to either raise hand or put questions into the chat, and we'll kind of engage our panelists now much more in a conversation. So some of the main trends that have come up thus far in the chat have, one, been on the community partnership side, and two, has been on cost. And so I will actually ask all of our panelists now a question on cost, and how do you deal with the cost of PrEP? And what is the usual cost for patients across all y'all's study?
I think I'll jump in with the specifics. So the question about who pays for the voucher, it's the research study, but from a sustainability point of view, I think everyone knows that it's very common practice when there's outreach occurring for there to be something that these community health orgs are often given to residents, but it doesn't have the same tie to the business that actually then allows for there to be two partnerships that's bought in. So oftentimes now the common model is like, a community health partner will kind of beg a business, oh, can we park here? Can we do this? But the business is not as invested because you're asking for an altruistic give that doesn't necessarily benefit their business. So that's one part about how the voucher system works and benefits the work that we do. And in regard to the PrEP part, recall that we are trying as much as we can to utilize pieces that are already in existence. And that's one thing I would also recommend. Like, there's no reason to create another path if there's someone else already in your vicinity, jurisdiction, or community doing it. These health partners are paid and have services to actually test, connect people to PrEP, figure out the insurance pieces that's a blockage, or tap into other resources. And so the fact that they're a part of the 5-point initiative in doing this work is that we don't have to think about that cost piece that would be embedded otherwise if we try to do it on our own. I think the other part that it then brings up is, again, around sustainability as well. And I think big picture, I think it was common across a couple of the presentations, but people who are of the community, who are proximal to the issues, the barriers, the facilitators, are key to doing this work. And so for my team, it's the community consultants, it's the team members themselves who are hired and are carrying out this work. It's listening to the residents, it's partnering with the businesses. So as much as you can, think about who's already there, who's gonna bring the knowledge, the lived expertise, and be able to actually reach the community. And I'll stop there.
And then for the work in Charlotte, I mean, Sannisha said it really well in terms of, finding out what structures already exist and see if you can partner with them. And so the Mecklenburg County PrEP Initiative existed and had existed for quite some time. And they do provide those funds to partner clinics so residents can get those free PrEP services. So there's no cost to participants. And so at the time that the initiative is existing, but it wasn't as well known as they would have liked it to be in terms of spreading the word to people who need PrEP the most. And so that's really one thing that our campaign will do, is then promote those clinics, promote that initiative, because cost was such an issue with the folks that we spoke with. So getting it out there that if you go to these clinics, which are very well known on their own and not well known to distribute PrEP, but if you go there, PrEP services will be free. So we don't have to deal with the cost of PrEP.
Yeah, and it's the same at Five Horizons. So they have a clause that insured or uninsured, they will pay for it. And I'm not sure if it's insured, they will bill your insurance and hopefully get reimbursed, but they have a program where there's no out-of-pocket expenses incurred to the student seeking PrEP.
Excellent. So one of the questions in our chat really kind of speaks to the broader themes of both this webinar series, as well as themes that each one of our presenters has touched upon, which is truly, what are the next steps now to translate your work from kind of research into practice and really sustain this public health impact of your work? And I will, before y'all quickly jump in, also place the nice secondary caveat to this on generalizability. how could one translate the work in which y'all have done in your respective kind of counties, cities, and zip codes and translate that to other EHE jurisdictions?
Yeah, so in terms of the sustainability part, it's part of it's built in for us to assess it as part of the ongoing R1 that we have now. So periodic meetings with everyone who's at the table beyond the weekly things to actually talk about and figure out, are there ways to sustain this as a whole? Parts, how will that work? I will say the fact that we leverage things that are already in existence already shows promise for being able to do that. And I also know that folks that have been a part of the work have already started to model things by using some of what they see Shine doing and us doing with the 5-point initiative. So we do believe that it's something that has promise for sustainability, but we are literally collecting data on that to figure it out and engage in our health departments and community health partners to really iron it out. The other thing I will say is that we're talking about generalizability in terms of EHE, but I would like to bring back too in that when we're doing this work and you're thinking about health equity, communities that are disproportionately impacted by HIV are also likely disproportionately impacted by other health conditions. So to be able to think about how our work can also potentially be used to inform work for other conditions and issues is also a part of how we should think about generalizability. And the contextual factors, I think it's always a key part to think about your local contextual factors and then what implications that has. And there are pieces, for instance, with a 5-point initiative that will naturally shift if this work was to be conducted outside of Miami. For instance, thinking about who those community consultants are, who are those key voices or individuals to make sure they're at the table, who are the health partners. But in reality, when you think about how it works, there is potential again for it to be applicable to other areas. I think it's about coming backwards, but then bringing in the important voices to see what needs to be adapted and changed for it to be successful.
For PrEP-MECK, I think we spent a lot of time on that sustainability question, identifying what strategies the partners really thought that they would want to do, that they really think they could do, because they're going to be doing it on their own when we test this out. And so, you know, all those discussions before, we really honed in on, you know, what really would be acceptable or feasible to them. And then part of the R34 is really then we have lots of measures in place to evaluate the feasibility of them. Is that something that a community-based organization can do while they are balancing a million other things that they have to be able to do? So can they do these things that we've developed together? You know, and moving forward, one thing, in terms of just thinking of these community academic partnerships, one thing that we've talked a lot about with our team is that balance of expertise and bringing that to the table. And I have a lot of projects that have community partners, and it's really to have those good discussions at the beginning in terms of what do you want out of this partnership. I mean, we're all going in it with those overall goals of we know we want to make lives better for folks who are living with HIV. We know we want to reduce new diagnoses. So we're all aligned on goals, but those intermediate goals, you know, I think lots of times, you know, from academics, we come in and we think everybody wants to be a co-I or an investigator and be at that level and have to deal with all the things that come with it in terms of biosketches and trainings and all that type of stuff. But that might not be of interest to the community partner, but they still want to be at the table having those discussions. And so that's something that, you know, Chelsea and I, who's with RAIN, you know, we spoke about that at the last EHE meeting, but I think that's something that I take forward in terms of really having those discussions and finding out what matters most at that personal level of the community members. And it may not necessarily be what the academics want. And that's totally fine, you know, because we all agree that the role that they play is still the same regardless of that specific title.
Yeah, and I'll just speak quickly a little bit about in terms of sustaining this work. So when we chose a community partner, Five Horizons Health Services, we didn't come with them and say, like, this is what we want to study and this is what we're going to do, and y'all kind of figure it out. They were going to do this work regardless. We just were able to kind of robustly say, let's evaluate if this is a good use of your dollars and time in your prevention efforts, right? Because they have a budget for prevention and outreach. And so they're going to do work, and they thought that this was important work to do, but they didn't have the capability and the money to actually evaluate and come up with good evidence to say, yeah, this is somewhere we need to continue to spend money. So Billy can go back to his board members and say, hey, this is worth it. Or say, you know, we need to do something different here. So I think shifting from like, as academic, you know, some of us that are in academics, like we kind of decide what we want to do, and then we try to figure out how to then make that sustainable. I think if we take what Sannisha was saying, like take things that are already existing and just make people aware of them, and then work from that base instead of like us trying to do something different and adding on and then trying to make that sustainable. Like take what already is growing and being sustainable and try to just make it a little bit better through implementation work and through this EHE work. It would be, you know, my advice on what we're kind of trying to do, and why I think that, and what I hope is that this is sustainable. And then our goal is to take this model and then model it at other HBCUs in Alabama, and then across the Southeast, and then hopefully, you know, to college campuses across the US is the goal, to really increase access to PrEP and HIV and STI testing.
Excellent. So on that, which I think is a very nice segue to kind of the broader question here of partnerships with community organizations. You all have kind of discussed very kind of in depth what these community partnerships would look like, but I'm wondering if you all could describe a little more about what your process was in actually selecting the community organizations and or venues in which you all partnered with, and particularly what kind of advice would you provide a researcher who is kind of coming into their research study? They want to partner with, you know, community venues and organizations, engage in community-based participatory research. Where do they start? What does that kind of introduction look like if we kind of capitalizing on Amy, what you initially described as engaging these community partners truly like from the start? What advice would you all provide to a researcher to do that? So Amy, Sannisha, you know.
No, go ahead, Amy. I was gonna say, don't do it yourself. And I say don't do it yourself because although we do this and relationships are built over time, for us and the work that we do, it's important to actually have as part of your team or pay as part of the infrastructure individuals who already have some of those pre-existing knowledge and information. Like I wouldn't go out raw and just approach a business and say, hey, I'm doing such and such. Actually, our community consultants or members of the team with lived expertise would help to inform that. And a lot of times they're already pre-existing knowledge. So one of our primary criteria is that it has to be a business that attracts and serves and engages with members of the Black community. But there are other nuanced things beyond that criteria that community consultants may know or understand in terms of that informing how we approach the business and what's the best way to kind of like build or advance that relationship. So that would be my kind of key takeaway is relationships take a long time to build. So make sure you're thinking about, are there individuals who actually can break or be a broker within those relationships? And also just giving things time, you know, to actually do that work.
And Morgan, you mentioned, you know, what type of suggestions we would have. And one thing that I would have is when you are planning this and looking at your budget to, you know, realize that a good chunk of your budget is going to go to your community partners, you know, and to believe in that and to communicate that. And so what we do is, you know, the community investigators has the same % time as the academic investigators. We have time that we do consultant agreement with all of our community partners. Everybody who recruits gets some sort of funding. And so nothing is volunteer really for the work that we do. We don't volunteer our time necessarily for our work. And so we don't expect other people to, but we really want to be able to get across the fact that, you know, we do want to share those resources. And so it doesn't all come to the academic partner, that there is some distribution that makes sense between the different groups.
Yeah, I would just echo that point that, you know, value them as much as like they value the work that they do in terms of with the budgeting for the work that, you know, they're going to put in. It takes a village to do, you know, any of this implementation work in the community. And, you know, just providing them those resources to be able to do that is, you know, really critical.
And because I do not want to miss one of our other questions nicely in the chat from Gerald. Do PrEP patients prefer Truvada or Descovy? And is there a demand for long-acting PrEP?
So the work that we did, we didn't look at the differences between Descovy or Truvada, and then long-acting injectable PrEP wasn't available then. But one thing we are trying to do is just increase awareness in general that PrEP is out there, and then get folks to a clinic to be able to hear more about that. I do know that there was a lot of concerns about just concerns about side effects, concerns about the advertisements that are out there. And so we just want to be able to counteract some of that, but really get folks to talk to a provider to be able to have those discussions so they can really have all their questions answered and have that time with a provider versus, well, that's our approach.
Yeah, and I would say it's the same for us. And to go back to the knowledge piece, like our surveys actually show that up to 70% of the community residents that we engage were not aware of PrEP prior to engaging with our team. So I think the awareness piece, the knowledge piece, the destigmatizing sexual health and well-being, and all those pieces are a precursor to the uptake of PrEP. But no, we did not get information in terms of like the nitty-gritty difference in preference in that. But I do think it's an interesting question, but folks have to sort of get to the table and understand what is being offered and how it could benefit them.
Yeah, I think we did ask a question about long-acting, like injectable PrEP, just if it would be possibly acceptable. And there were, I believe, about 50%, about the similar amount that said they were interested in a pill they could take every day. Were also interested in an injection that they would take, you know, possibly every month or every few months. So, but I do think that comes with a whole nother you know, there's a lot of implementation challenges associated with that. People trying to get injectable PrEP, just anecdotally here in Birmingham at the Student Health Clinic here is a nightmare because insurance doesn't pay for certain ones and it's a mess. So I think that is a great question, and that's definitely where we're headed. And my goal and sincere hope and thought is that one day, looking at women who are at risk for HIV, is that they can get Depo and their PrEP injection at the same time on a 3-month interval. So if we can make that happen, that would be swell. But I do think there's definitely desire and demand for it. How that teases out will be a whole nother realm of implementation work, I think, to figure out the best way to do that in the future. But thank you for the question.
Can I follow up my question?
Yeah.
This is Gerald. I think one of the problems with Descovy was that, okay, so Truvada has an appetite suppressant, Descovy doesn't. And so people are noticing that if they switch to Descovy, they gain weight, which a lot of gay men don't like to do because that's kind of a big deal. And of course, the cost, Truvada is generic, so it's cheap. Descovy is the patent drug, very expensive. The shots are even, of course, much more expensive. I think they say $40,000 a year. So, I mean, there's a real difference in terms of what people want and what people can afford, and what governments can afford to provide. So it's kind of an interesting thing to get into.
And I will say, not to send people over to our Facebook, but we do these things called Charming Conversations for the core that I lead for our Center for HIV and Research in Mental Health. And we had a conversation about injectable ART, both for prevention and also as treatment. And the nuances that were brought up, all from people of lived expertise and actually who are actively using these medications, were very rich. So if people want to go over to the CHARM website and look at that Charming Conversation, that could also be super insightful. But there are a lot of nuances that folks are considering in terms of, even if they're on like a daily regimen, whether or not they want to switch to the injectable. I heard terms such as like, it feels like freedom from a beautiful colleague, Daniel Driffin, about his transition from using daily ART for treatment versus injectable. So I think it's very nuanced, and it's an ongoing thing that we should continue to explore and think about. But I think at the end of the day, it should be autonomy. So how do we remove the barriers so that people can either get their daily regimen or the injectables? And how do we make sure that they're fully informed to make the best decision for their health?
Excellent. And it's such a beautiful place to end our time together and removing barriers and thinking of how this work continues to kind of grow and scale up and out. I would like to end this with, of course, a great thank you to all of our presenters. And then, of course, to all of you for attending our inaugural EHE project webinar series. The recording of this series will be uploaded onto ISCI's website, and stay tuned for our next quarter's webinar series as well. That, once confirmed, will be disseminated through our interchange as well as on our website. And with that, have a great rest of everyone's day and a fantastic weekend. Thank you all.